Sexual violence and intimate partner violence are among the most severe stressors that women may experience in their lifetime and can have numerous social and psychological consequences. Psychological distress reactions are common following violence. These reactions may be overwhelming, but are normal and often temporary. Most women recover if the violent situation passes, especially if they feel safe and receive emotional support from people they trust. The impact of intimate partner violence on mental health can be more subtle, yet very harmful. The violence may occur repeatedly and over a long period. It can grow worse and involve extreme emotional abuse. Psychosocial support must take place from the first contact with the survivor. It is essential to provide basic, non-intrusive practical care. Listen, but do not force her to talk about the event, and ensure that her basic needs are met. Because it may cause greater psychological problems, do not push survivors to share their personal experiences beyond what is absolutely needed to provide medical care and beyond what they would spontaneously share. However, when a survivor clearly shows a desire to talk about what happened to her, it is very important to allow her to do so and to listen to her. Here is some information about psychological and emotional signs and symptoms and how to respond to survivors. A survivor of sexual and intimate partner violence may be unable to complete normal and routine mental and physical tasks. She may not be able to care for herself or others who depend on her. If she is unable to work or misses work as a result of the violence, she may lose a significant amount of income, creating additional hardship for her and her family. Survivors of gender-based violence may feel shame, which damages relationships between them and their families and communities. This shame may also be faced by survivors' families and by children who are born as a result of rape. Survivors of gender-based violence are often relieved to know that their reactions to it are normal, common, and often temporary. This knowledge itself can help survivors cope better with their concerns. Healthcare providers should let their patients know that most women who have been exposed to violence experience signs of emotional distress. These reactions are normal and common in people who have gone through a stressful, frightening, or traumatic experience, and, in most cases, symptoms will improve and the patient is likely to feel better with time, especially if she has received practical and emotional support from others.